Welcome back to Med School Radio. This is Simon in Tokyo, and we're going to be looking at some MCQs on appendicitis, so let's take a look. A 19-year-old woman comes to the ER because of intense right lower quadrant abdominal pain. The abdominal pain is sharp in character and has been present for 2 hours. Her temperature is 37 degrees, heart rate is 90, respiration 16, and blood pressure is 120/70. Abdominal examination shows tenderness with deep palpation at the McBurney point. There are no peritoneal signs. Laboratory test shows leukocyte count of 13,000. Which of the following symptoms is the most likely characterized in this patient? A. Abdominal distension. B. Hunger. C. Nausea and vomiting. D. Profuse watery diarrhea. Or E. Vaginal bleeding. The answer is C. Nausea and vomiting. The major takeaway here is appendicitis is classically characterized by anorexia and periumbilical pain, followed by nausea, right lower quadrant pain, and vomiting. The movement of the abdominal pain from periumbilical to RLQ is the most sensitive and specific symptom compared to all other symptoms associated with appendicitis. Remember that distension is rare in a patient with appendicitis unless diffuse peritonitis has developed. Patients with appendicitis are typically characterized by anorexia. Hunger in a patient with appendicitis should make one reconsider the diagnosis. While diarrhea can occur in a patient with appendicitis, profuse, watery diarrhea is more suggestive of acute gastroenteritis rather than appendicitis. Vaginal bleeding does not typically occur in appendicitis and would be suggestive of rupture of a corpus luteum cyst rather than, rupture of a Graafian follicle or a ruptured tubal pregnancy. So that's the answer there. So if you were thinking it was abdominal distension, you're wrong, because this occurs when substances such as air or fluid accumulate in the abdomen and can be secondary to a functional bowel disorder such as IBS. The patient comes with a classical presentation for appendicitis, which is highly associated with nausea and vomiting. Okay, let's try one more. A 25-year-old man comes to the ER because of excruciating abdominal pain. The abdominal pain is localized to the right lower quadrant. A day ago, the abdominal pain was located in the periumbilical region and was less severe. His temperature is 37, pulse 95, respiration is 18, and blood pressure 130/80. Abdominal examination shows tenderness with deep palpation. Laboratory studies show a leukocyte count of 15,000. Which of the following is the most sensitive finding for the patient's likely diagnosis? A. Pain 3 to 5 centimeters from the anterior superior iliac spine on a straight line from the anterior superior iliac spine to the umbilicus. B. Pain in the right lower quadrant with palpation of the left lower abdomen. C. Pain in the right lower quadrant that is worse with movement. D. Lower abdominal pain elicited by passive right hip extension. Or E. Right lower abdominal pain with right hip extension and external rotation. Not so easy to figure out here. Anyway, the answer here is pain 3 to 5 centimeters from the anterior superior iliac spine on a straight line from the anterior superior iliac spine to the umbilicus. The major takeaway here is that the diagnosis of acute appendicitis can be supported by clinical signs on abdominal examination such as tenderness at McBurney's point in the right lower quadrant and Rovsing's sign, which is tenderness elicited in the right lower quadrant with palpation of the left lower quadrant. Remember here that diagnosis of acute appendicitis is usually based on history and examination, but may be supported by imaging, specifically abdominal, ultrasound, or CT. Thanks for listening.